We're live now, Chair. Over to you.
Okay, thank you. So welcome everybody. Welcome to the public session of the Rotherham Integrated Care Partnership Place Board. This is our October meeting. We're just going through. We've got apologies from Sharon Kemp from Rotherham Council, and we've got apologies from Richard Jenkins from the Rotherham NHS Foundation Trust. Any other apologies anyone wishes to record? Okay, thank you. So just moving on, in terms of public and patient questions, obviously we're open to questions if anyone wants to write in prior to the meeting. I don't think we've received any prior to this meeting. No, so nothing to do there, but obviously if anyone has any questions, please don't hesitate to write into us. So the first business item we've got today is the Rotherham Integrated Partnership Agreement. Ian, would you be all right just to introduce this item?
Yeah, I would. Thank you, Chair. So just bringing into the public domain an updated version of our integrated partnership agreement. So just to remind members that we have had a partnership agreement in place for a number of years now, which is in effect the kind of cornerstone of our joint working within the Rotherham Place. Partners felt the need to update the document in line with some of the kind of national guidance that had come out mainly over the summer period, linked to the proposed white paper and the integrating care agenda. So what we've done is we've updated it accordingly. You can see within the covering paper there that we've taken the opportunity to review and update our principles. Partners are supportive of those. Those principles then align not just with the place, but in the wider South Yorkshire and Bassett law context. Linked to that, therefore, we've updated our terms of reference for the place board and delivery team. Linked to an updated place plan. We've also started to move towards a development plan, which is next on the agenda, Chair. So the ICP agreement reflects all that. I think we do acknowledge, and it does state in the paper, that this will be up for change and iteration as we move through the transition process to a formal ICS. So although it has been updated, it probably will be updated another couple of times, we would have thought, as further guidance comes out and the system architecture develops further. So in terms of the recommendation, Chair, we're asking members to approve the updated agreement and note that the ICP approach will be subject to further development over 21 and 22, as I've just described. Happy to take any comments or questions. Thank you.
Thanks, Ian. So I think the thinking is that before the South Yorkshire Integrated Care Board is formed on the 1st of April 2022, subject to going through Parliament, that we'd refresh it prior to that to make sure we're absolutely fit for purpose for the new NHS infrastructure. Okay, everyone are comfortable with that? I'll take silence as assent, so we'll assume that everyone's happy with that version for now, recognising we'll continue to work on it over the next few months. So thank you. So Ian, that takes us nicely into the next agenda item. So do you want to keep going?
Yeah, I will. Thank you, Chair. So this is a document that we've members have seen on a number of occasions now. So what we're doing here is just highlighting the progress that the Rotherham Place are kind of actively engaged in terms of moving us towards the integrated care agenda, to the development of place and the integrated care board from our perspective, ensuring due diligence, etc., is undertaken within our system. So this is running us through to our Q2 position. And again, there's not a lot actually to raise by exception in this space. You recall, members, that we agreed what in effect were 11 domains in terms of our development, which are described here. Pretty much on track for most of those. There have been a number of date changes, and we've identified those in the status and just describe where the dates have changed. Many of those just relate back to the kind of awaiting further guidance, continued work in the place, but there's nothing that I'd escalate specifically into place board today, Chair, that is of significant concern. Again, number of partners around the group and the board have been heavily involved in this, so happy to take any feedback from them, but it's just a note at this point in time. Thank you.
Okay, we'll just open it up for any questions or comments. Is everyone comfortable with this as we just discussed? Okay, getting nods. So thank you. So thank you for that update, Ian. That's really helpful. So we'll come back again in another quarter for the next update. Yeah. Okay, so we can put that on the forward agenda.
Thank you.
Okay, so we're now on to the Provider Alliance update. So it's down for Michael and Catherine. I don't know if one of you would be okay to give the update. Catherine, are you okay just to start us off?
Yeah, thank you. Morning, everyone. So during the last few months, we've received more guidance in terms of provider collaboratives. As the group know, we're working both in a place way, trying to establish a provider collaborative, which would be multi-sectoral and would engage with whole pathways of transformation and collaboration. So looking at how potentially mental health, primary care, the acute sector, social care all work together in a single collaborative format. So as I say, lots of guidance has been issued predominantly around the integrated care system, but within that there is guidance on provider collaboratives at scale. So we're using that. We've got some work in progress ideas about where we would like to make a start, and we are being supported in this work by Sue and Esther from Hill Dickinson. And we're starting to look at what others are doing, trying to work through what might be the real benefit for us working together as a group of providers at place. And I think fundamentally it is about how we reduce variation, how we can actually improve the health outcomes for the population of Rotherham, etc. I think importantly, it's worth just noting as well that there are sector provider collaboratives that are now being established. So there's an established acute federation of all of the provider trusts across South Yorkshire. There's an emerging mental health alliance, similarly, of providers. And in addition to that, there is provider alliances forming around primary care and around general children's services. So I think importantly for us at Place, we've got to be very cognizant of how we're going to operate both with the new infrastructure around integrated care systems and partnerships and boards, but also what does that mean for us at Place, and how will we be both facing towards the ICB, the Integrated Care Board, with all of its new functions and powers, and how do we operate across single sector federations as well. So it's quite a complex set of changes that are coming into play. But I think importantly, it's about how we ensure that Place is well represented in any collaborative that is created. So I'll probably pause at that, Chris.
Now, thanks for that update, Catherine. Any other providers like to add anything to that update? Okay, must have been very comprehensive then, Catherine. So, and I think that the thing is, isn't it, is to work out in the new infrastructure of an integrated care board about how provider alliances sit and how we can make sure that everything works in harmony together to get the best possible outcomes for Rotherham patients. So we'll keep that work doing, and we'll keep the updates coming to this board as well to make sure we understand how we can use the new legislation and the new arrangements to improve patient services and outcomes for Rotherham patients. Okay. So thank you. So I'm going to move on to the transformation group updates now. So Susie, are you okay to give the children and young people update?
Yeah, I'm going to bring in Alex, if that's okay, Chair. Alex Hawley is going to do a presentation on our spotlight, which is the first 1,001 days.
Yeah, thank you, Susie. I'm going to try and share my screen. Let's hope that works. I'm not used to using Zoom.
Yeah, brilliant. Thanks, Alex.
Just going to the, hopefully you can now see the slide view. So the first slide, we can move on from that. So in terms of what's working well, there's 4 aspects that of current work that I've chosen to highlight here as working well. First is the 0 to 19 service, which obviously is a service commissioned by Public Health, principally to deliver health visiting and early school nursing service. And it's provided currently by TRFT, and performance is good, and that's despite some of the disruption of the pandemic. And they've developed a good skill mix staffing model, which enables them to match skills to where they're most needed, which is really good in view of current recruitment issues in terms of specialist nursing. The second point is about, well, it's about the same thing, but it's about commissioning the new contract for the same service, which will commence in 2023. And I think it's fair to say that recommissioning process thus far has been exemplary, with really good partner engagement, good consultation processes. Specification development is nearing completion, and that's based on new guidance that's been issued. And we've got a really good within our embassy, we've got a good enhanced level of specialist commissioning support for public health. It's been really helpful. We recently ran a market engagement event worth mentioning. We had good provider representation there, and we're able to highlight the importance of social value in our selection processes. And we're also just at the moment talking to Rotherham Parent Carers Forum about doing some co-production work for us to inform the specification for that. Third point, I've just highlighted there the trusts grow your own model in terms of their how they fill vacancies. For specialist nursing, there's a national shortage of specialist community public health nurses, so they've developed this model of bringing on in-house staff nurses up to becoming registered SCPHNs, which I think is a really good model. It's a really good local response to a national problem. I think it's also important to acknowledge that a greater focus, this is moving to the last point, on 1001 days, excuse me, has been made much easier by the changes that within the public health team, excuse me, that we've, well, really that a new DPH Ben has put in place since he came along, and once we were in a more stable position to, in terms of the pandemic response, and we've realigned the public health consultant portfolios to mirror the four aims of the Health and Wellbeing Board strategy, and that means that my portfolio is now aligned to aim 1, which is obviously to give every child the best start in life, and this has been really in place since July. Obviously makes it much easier to engage with 1001 Day priority in a much more coordinated way. Thank you. Glass of water just arrived on cue. Things that we're concerned about, this obviously has to include the impacts of the global pandemic. It would be odd if it didn't. An impact on children's education rightly features strongly in the media, but I think we should acknowledge that there's likely to be a cohort of babies born during the crisis, and who have had much of their 1001 days during restrictions on social movement, which might mean a cohort suffering a unique disadvantage, potentially with lifelong effect, and almost inevitably following a social gradient, so widening inequalities. There have also been impacts on access to healthcare, and as I said, our 0 to 19 services have responded well to the pandemic, and also responded positively to in respect of particularly breastfeeding, and the fact that volunteer peer supporters disappeared during the pandemic, and they started to recruit paid peer supporters, and that seems to have had significant benefits for us. The second point on the slide there is, I suppose it's meant to summarise the room to improve the whole system with respect to pathways, handovers, priorities, etc. And I think it's really important that we're not just providing a service, but we're making the whole system work for our children. And the third point, I've chosen to highlight breastfeeding specifically on this slide, simply to reflect just how important I think this is within the 1001 days sphere of influence. And it has links to so many other outcomes, such as mental health, cancer risk, child oral health, nutrition, healthy weight, and many, many more. So I think that, although it's something we're concerned about, I think it's also a great opportunity for Rotherham as a place to become a breastfeeding friendly place. And the final point, I think, perhaps in a way, goes back to the beginning in terms of impacts of the pandemic. That's demonstrated that events and changes within the system are something that we always have to be vigilant for. It's probably fair to say that COVID-19, I suppose we always knew there was going to be a pandemic at some time, but the way it actually transpired was probably impossible to predict. But that doesn't mean we shouldn't be prepared as much as we can be. And I think we should also be mindful. I think we've just heard about the provider alliance and changes to the way the health system is organised. These things are always going to have impacts, and I think we should also acknowledge that even the commissioning process itself that we're currently engaged in inevitably creates some uncertainty and jeopardy, and those are things that we have to mitigate, and that's what we're doing. So I'll move to the next slide. There you go. So this is moving to the final point, which is what needs to happen next. I've actually got 2 slides for this, but the main thing to take away really is the one at the top there. And I suppose this is a response to the previous slide and the reference to system upheaval events. And this is the idea that with our partners across the children's workforce, we're trying to create a strategy, a framework within which partners can coalesce around common priorities and around the 1001 days priority in particular, as part of a sort of life course way of looking at children from preconception to transition to adulthood. And so you will see that on that slide there, we've got a workshop which is sort of almost kicking off the process really with partners next week. And the second point there, there's probably not much to add really, other than we need to complete the process for recommissioning, and as I said, it's going well so far. And then finally, I've just put 3 more points of work that are ongoing and that are of interest. And probably it's worth just highlighting the top one in terms of oral health. It's a big problem in Rotherham. We've got the highest rate of hospital extractions from under 5s. And there's work ongoing across South Yorkshire to look at the feasibility of fluoridating our drinking water. And we will soon have a fully costed engineering study of how and where to build dosing points. And that, I think, puts us in a very advantageous position should that become a realistic possibility. And it's worth noting the recent statement from the Chief Medical Officer and the fact that legislation is currently working through Parliament, which might well make that a more likely outcome. And the last 2 points on the slide are things that we're currently doing with the current 0-19 service to improve it and to get things closer to what's within the revised guidance for the Healthy Child programme. So I think that concludes my presentation.
Okay, thanks, Alex. Do you want to just take this share screen down? Thanks. We can see all the faces again now. So any questions or comments, anybody? Well, okay. So we'll move on to the next update then. So we've got update. Sorry, we've got someone.
Sorry, Chris. I'm not used to the Zoom, so I'm finding a struggle to put my hand up.
Dr. Mutu, do you want to come in then?
Yeah. Thank you. Thank you. Thanks, Alex, for that presentation. The only question I have is about the Healthy Child program. This has been going on for many years, I think, starting from probably 2013 or something like that. Having said that, in that, they have health visitors as a key person involved, health visitors and school nurses as well. We've not had health visitors in our practices for a few years now. I just wonder whether that's something that we need to look at in Rotherham again, whether we bring back those health visitors to be within practices, whether that's up in the pipeline or something which has gone obsolete. Could you just give us an idea where we are at that, please?
Yeah, thank you for that. I think it's probably worth mentioning that, I mean, this actually is particularly relevant to 1001 days. There was a review recently published, led by Andrea Lebson, into sort of review of best start in 1001 days. And that really is pushing, and I think this is where national government may be going at the moment, is pushing towards this idea of a family hub sort of co-location model. I think the approach that we're taking with the way that we're writing specification for our new contract is to be not to be overly prescriptive, but to be enabling of models that look as though they'll work best and are able to adapt as both national and local priorities change. So I think we wouldn't necessarily be prescriptive in terms of whether co-locating within GPs, but I think it's clearly a model that might be part of an overall sort of mixed model that providers propose. I can see the Ben's going to
Alex.
as well.
Ben, do you want to come in now?
Yeah, I mean, just to, I guess, follow up from Alex's response to that, I think for me, the important bit in Alex's presentation is the separation between recommissioning of the 0 to 19 service and the best start and beyond strategy. And it's the service is a service within a system, and it's the system response that we need to get right. And as Alex says, there are those moves towards family hubs and different models of how we coordinate services around children, but services around families as well. And I think that's the thing, that when we get beyond the recommissioning of the service, having that wider strategy and developing those pathways and bringing together, because health visitors and 0 to 19 services play a big part in children's lives, but so do primary care, so do education, so do early years. It's all of that system working together, and I think that's what the strategy focus will give us for Rotherham and bring to place.
Okay, thanks, Ben. So just wrap that one up. So I think we can move on now to the mental health and neurodevelopmental update. Ian, you've got an update on the autism strategy and neurodevelopmental pathway?
Yeah, I have, Chair. Thank you. Can I just check that that's screen sharing with colleagues?
Yeah, we can see that.
Is that coming through? Okay. All right. Thank you. Okay. So I know we've not updated Placeboard on a range of priorities for a while, but just to remind colleagues that within our previous place plan and now flowing through to the updated one, linked to our development of our autism strategy, we've got a commitment in the Rotherham place to develop an all-age neurodevelopmental pathway. This update focuses on priority 10 of the mental health and LD delivery team, which is predominantly around the adult aspect of that pathway. So I'll just update colleagues in terms of the work that's happened throughout pretty much the last 12 months and then just flag up the areas of work we need to take forward going forward for the next 12 months. So in terms of what's working well, if you recall, as a Placeboard, we supported the development of a Rotherham-based diagnostic service back in 2019. Additional funding was introduced into the system and prioritised by colleagues in the place, and we've launched our expansion of our service in September 2020. Given the demand in that service that we've seen in that first 12 months, we've also agreed to further expand the service, and we expect that expansion to go live, provided by our colleagues, from December 2021. Linked to that, at the same time of introducing a Rotherham Place diagnostic provision, we also introduced a neurodiversity support service, so a post-diagnostic support service for adults delivered by the Parent Carers Forum in Rotherham, following competitive tender. And again, with the demand on that front end of diagnosis, we've also taken the opportunity to further expand that provision to meet need. We continue to have some really good positive partnership work across this area. You can see there from the couple of points around the neurodevelopmental group, which has been established across the pathway. And again, we're linking across the adult neurodiversity support service and the adult autism diagnostic provision. So what we have done in that year one is reconfigure the post-diagnostic pathway. So taking learning from the feedback that we've had from service users and the provider to improve flow. And we've also continued to undertake a gap analysis to review the Rotherham's autism strategy in light of recently published national guidance. So we're underway with that piece of work at the moment. Can I just double check with board members that page has moved on? It has on my screen. Can I just check it as we've
Yeah,
started?
we've got a slide titled "What We're Concerned About."
That's lovely. Thank you, Chair. So I think what we are concerned about, I've just identified how we've commissioned additional support after the year one activity, both in diagnostic and post-diagnostic, but we still require further work to understand the capacity of what's going to come at us over the next couple of years. There are our gap analysis, and I identified a couple of areas that we need to deliver in terms of unmet need. So those that are post-diagnostic, for those that don't have a recent diagnosis, but also those that have not been able to access support at the time of their diagnosis. So we're going to work hard to improve that. And then also this area of preparing for adulthood. Again, this links back to the point that I made right at the start of the presentation around all age provision. So I describe it as now knitting the pathway together. Now we've got the resource in place across the system. And as it says here, just bridging the gap between what might be classed from a family's and an individual perspective and a carer's perspective with the cliff edges of transition. So we've got to put a lot of work into that over the next 12, 18 months. And then there's also identifying needs around supporting the Rotherham autistic population with transport. And again, just a little note there around, we have got some additional funding to support this via the Transforming Care programme. So we'll feed back to members accordingly in that space. Okay, so what needs to happen next? I've covered most of those areas, Chair. We'll mobilise the expansion of both diagnostic and post-diagnostic aspects of the pathway. We'll continue to review demand management. I think linked to this, and this is why I use the word neurodevelopment pathway, we were really clear that we said this wasn't just an autism piece of work. So we really need to focus in on that ADHD element of that pathway under this piece of work. And that's what we'll be doing now. We'll talk through the work that I've just described with South Yorkshire Passenger Transport Executive, and we'll feed back in the future. So hopefully that just gets colleagues up to speed with that element of the pathway. We will bring further updates around the children's element, which is also key to the group in a future meeting. Okay, thank you. Happy to take any questions. I know there's other partners that are fully engaged in this agenda. Thanks.
Thanks, Ian. Thanks for that update. That's it. You just take the screen down. So any questions or comments, anybody? I haven't got any hands up, I don't think. Okay, so thanks for that update, Ian. Very comprehensive. So I think if we move on to the urgent and community care update, please. We've got an enhanced health in care homes update. I think we've got down for Michael and Anne-Marie.
Struggling. Shall I try and share screen, Anne-Marie, and just...
You want me to share? I want
Yeah.
to share screen if you want, Anne-Marie or Michael.
Yeah, I'm struggling to share mine, Michael.
You want to do it, Michael?
I'll try just one
I
second.
think I've jumped out again.
See if I can do it.
I can't see anything on screen though. Michael, can you do it? Because my screen's just gone blank.
Sure. Is that sharing now, guys? Can you see it?
Yes.
Okay. Are we on the...
Yes, Michael, we can
see. Okay, great. So as part of the part of the urgent and community care,
That's all I've got.
We have the enhanced health and care homes, which is quite a key programme for us. Other areas that we're really majoring on is discharge. We've already got the integrated discharge team that's functioning really well, but this little slide deck just focuses on what we've done in terms of enhanced care in care homes. So what's working well? There are quite a few areas actually that are working well. We've got strong integrated working in care homes, which has been particularly evident throughout the pandemic. We've targeted holistic support for care homes. There's a number of improvements in the digital space. The vaccination rate is 98% of residents and staff in homes for older people with learning disabilities receive first dose. We have a few areas that we're concerned of that we're particularly drilling down on, for example, heavy reliance on agency, which will ultimately impact cost and also will have an impact on quality ultimately as well. We've got low bed occupancy rates, 86% pre-pandemic and 78% now. and just a general fragility in the market, which we're concerned about, which may result in care home closures, which would be, which would be really challenging for us to manage. So in terms of what we're doing to address and take some of these forward, we've got a clear plan of what we need to do next, which is articulated in this final slide. So it's around integrated MDT working and referral routes, providing home residents and families with parity of access, streamline physical and mental health care home teams for simple access and support. There's a Rotherham health record for care homes developed and implemented to health and social care practitioners, and secondly, piloted and designated care home staff. Holistic approach to hydration in care homes, because that's pretty critical, really, and joined up commissioning across health and social care. So we're very much working collectively on this. So you'll see across the slide, we've got the next steps and then the planned completion date by Q4 this year. Currently all showing green. At that point, I will try and take this down and take any questions. Thanks.
Okay, thanks for that update, everybody. So just any questions, any comments, anybody? All okay? Okay, so I'll just keep us moving on the agenda then. So we're down to the revised health and wellbeing plan priorities. So who's best to take this? So is it this one for you, Councillor Roach?
I'm just going to say 2-3 sentences and I'll pass over to Becky. Basically, as people may remember, that during the early days of the pandemic, we decided that we ought to have just a 1-year strategic plan for the Health and Wellbeing Board, which we did, which came to its conclusion in the summer. Obviously, we needed then to develop a new plan, and so therefore, after a couple of sessions with board members, variety of ways, we had some key principles linked into that. One was that we needed to make sure that whatever was in the strategic plan, it fitted very closely in with local place plan. And also we need to be aware of developments in the ICS, how that might affect future work in the in our Health and Wellbeing Board. And so basically, after a lot of sterling work by Becky and members' input, the new revised plan was accepted by the board at our last meeting. Over to you, Becky.
Thanks, Councillor Roach. I think the best page, the most useful page for you in the agenda pack is if you just go to page 8 or page 4 of the appendix, which is around the refresh of the priorities. And this just shows the 4 aims and then also the 12 strategic priorities that were agreed by the board. So the 4 aims, I think Councillor Roach noted that was they were maintained. They were the same aims that we've had in the health and wellbeing strategy since 2018, as board members agreed these are the right things to focus on. What's really changed is the strategic priorities that sit underneath this, and in some cases it's been particularly around aim 1, it's been around consolidating the focus and making that a little bit more focused and improving the alignment with the place board as well. And for aim 3 and aim 4, it was about clarifying the relationship between the two. So all Rotherham people live well for longer is more focused on kind of the lifestyle interventions and people taking action to support their own health. And then aim 4 is more around the wider determinants of health and creating the right conditions for people to lead healthy lifestyles. So those are kind of the main changes. I think the reason for this coming to this meeting is to maintain that really strong governance link that we have between the Health and Wellbeing Board and the Place Board, and hopefully you'll be able to see that working with Suzanne Joyner, Dr. Jason Page on aim 1, and with Catherine Singh and Ian Atkinson on aim 2, we've really maintained that strong relationship between the Place Board and the Health and Wellbeing Board priorities. I don't know if Ben has anything that he'd want to add into that.
Not from me. I think the only other thing I'd like to add to that is that, as it says in Becky's paper, we still need to do a bit further work with sponsors. We're still working on one of the sponsors. And I think we need to make sure that we then refresh in detail the plans of the 4 aims. Just to also finally say, some of you may be aware that there's also a joint South Yorkshire Health and Wellbeing Board, which meets quarterly, and if you like, is a public face of the interaction of all 4 boards with the ICS. And we are due to meet with Sir Andrew in the very near future, whoever is the successor, to discuss how that might work and how we might move that forward.
Yeah, thanks everyone. Ben, did you want to come in on that point?
Yeah, just thanks Councillor Roach and Becky for presenting. I think the only thing I'd add is just the focus going back to actually what are the key preventable causes of ill health in there, and sort of section 4.2 of the paper, the briefing paper that was submitted, just goes through those, and I think that's where that alignment Becky talked about between aim 3 and aim 4 around supporting individuals to change behaviours and changing place to enhance behaviours, obviously focus on sort of the impacts on smoking, diet, alcohol, etc. through that is going to be really important for us.
So thank you, Becky, Councillor Roach and Ben for those updates. Any questions from any other partners? Okay, we'll keep going then on the agenda. So we've just onto the draft minutes from last time. I won't go through them page by page, but are we happy to take them as an accurate record? I'll take silence as approval. Okay, so thanks, Wendy. If we could record those as an accurate record. Just in terms of communications to partners, Gordon, is there anything you think we need to come for communications to partners as a result of this meeting?
I've not picked anything up from this meeting, Chris, that we need to escalate or communicate out, but I'm willing to take any feedback and take it on board.
I guess it'll be as we work through and move towards the 1st of April and the legislation changes, we'll need to make sure that all our stakeholders are fully informed of what the changes mean, because I'm just aware of we can sometimes sound very managerial and have you know, our own language in the NHS, so we need to somehow simply explain how these changes will improve things for Rotherham patients.
Yeah, so it's in the plans to, at the right time, communicate and engage with all stakeholders and patients and the public about the changes and what that means and how people can be involved. So we will be doing that over the next few months in the lead up to April as things become clearer and as legislation passes through Parliament and Royal Assent.
Okay, thanks, Gordon. So just looking through then, so any risks or items for escalation that anyone would like to raise, this is a good time to raise them. Okay, nothing by exception. Okay, so in terms of next time's meeting then, so we've talked about the Rotherham Place Development Plan quarterly update will come for the next quarter, and we've got the review of Rotherham Place-wide IT services coming in December. So for our November meeting, Ian, are we thinking about bringing something around ICS? We have to call it integrated care systems will form into integrated care boards. Is there something we could bring next time in terms of the development towards that goal?
Yeah, I think so, Chair. I know we talked earlier, didn't we, around our own development plan, but we'll probably bring more of an update slide set through around how the development of the integrated care board is working in South Yorkshire, and therefore the implications for Place.
Yeah, okay. So if we could just put that as a forward agenda item. So just before we sign off, we do next meet on Wednesday, the 3rd of November. Is there anything anyone would wish to raise before we sign off? Okay, well, thanks everyone for your participation, and thanks for watching, anyone who's watching, and we'll meet again on the 3rd of November. Thank you very much.
Thank you, Chris. Bye, everybody.